The human body is an incredible working machine. It uses an intricate series of systems that work together, helping to create the body's amazing complexities of movement. But it's no secret that our bodies are always changing, and the natural aging process affects us both inside and out.
Just like your heart, your hips, or your knees, the spine grows old with the rest of us. And when the spine ages, a lot of unique things happen to it.
What we know is that the spine actually starts aging at a relatively young age, somewhere around in our 20s or so. And the strongest predictor of how your spine is going to age, meaning how fast it's going to age and how severely it's going to change as we age, is really genetics. So your mom and dad really are going to predict how bad your spine disease are.
Like hearing or eyesight that can diminish over time, the human spine also undergoes changes as the body ages. While aging is inevitable, the rate at which the spine shows the effects of getting older is unique for each person.
The first thing that happens is the natural curvatures of the spine start to change, and our spine starts to straighten out. And as it starts to straighten out, we don't carry the weight in the same way, and that can start to cause pain in the different areas of the spinal column. Usually, the parts of the spine that move the most during normal movement and activity in our lives are the parts of the spine that actually degenerate the fastest.
So this concept of the degenerative spine, whether it is a spine that is unstable, a spine that is out of alignment, a spine in which the canal is too narrow for the nerves and you can press either the entire spinal sac or a bone spur pinches a nerve on the way out to your arm or your leg. All of this contributes in various ways to pain, to debility, to decreased quality of life.
Well, I'd get to work after driving for 20 minutes, sitting down, and I'd get on my truck and I'd kind of like have a seizure in my back, and I'd have to stop and just sort of like stretch it out. And I was in a carpool with some other guys. They'd go on in, and they knew I'd make it in eventually.
A normal part of the aging process involves the deterioration of tissues, especially those of the spine. As this happens, back and neck pain become common and are usually symptoms of an underlying spinal disease that can be safely and effectively treated.
Once the degenerative process starts, there's really no way to reverse it at this time. So the foundation of treating the aging spine is really good, healthful changes. Diet, exercise, weight loss, not smoking, avoiding other toxins. The next intervention or next layer of things would be interventions that healthcare providers like doctors can do, and that would be usually specific types of injections that can be done to calm down the inflamed parts of the spinal column. It would be including things like physical therapy or occupational therapy to strengthen the spine or rehabilitate the spine specifically. And if those things don't work, then you would go on to potentially surgical management of the spinal column.
For patients with a history of back pain that has interfered with their daily lives, the first step is proper diagnostic testing to determine the cause and severity of the problem. Experts at diagnosing and treating pain, the team of medical professionals at Neuro Pain Consultants utilize a multidisciplinary approach to successfully help relieve patients' symptoms.
One of the advantages of seeing a multidisciplinary group is that we are able to offer the entire spectrum of the various treatments, both surgical and non-surgical, to the patient who presents with some type of a pain problem or pain syndrome.
I think the most important thing as far as dealing with a complicated or even really an uncomplicated pain problem are dealing with full-time specialists who really do this, every day. What we know in medicine is it's just like being a baseball player or a lawyer or anything. You really want a specialized person taking care of you, and if you can work with a group of specialists using a team approach, I think you're going to have the best outcome.
When you come here, it's a professional setting. You fill out the chart, where it hurts, what you want to talk about, what's on your mind, what do you want to know today. They take care of you, they answer your questions.
Dedicated to providing world-class specialized care for those suffering from chronic pain, Neuro Pain Consultants has combined a highly trained team of neurosurgeons with a well-respected pain management practice to improve patient quality of life and their ability to function each day without pain.
Here at Neuro Pain Consultants, our goal is to provide individuals with relief of their pain and every bit as important, to help restore quality to their life.
Each patient that visits Neuro Pain Consultants receives a thorough physical and neurological examination. All diagnostic tests are then reviewed carefully to determine a customized treatment plan.
We review the medical history as well as these psychosocial issues and really come up with a specific plan. Sometimes that plan may be something relatively straightforward like an injection. Sometimes it may be something very complicated like an implantable device that we use to treat pain. Sometimes it would really necessitate almost all the members of the pain team, the neurosurgeons, the pain specialists, the rehab specialists, and the psychologists to work together to try to improve outcome if it's a very complicated, long-standing pain problem.
Regardless of what their underlying ailment is, we are able to tailor a treatment program specific for not just your underlying diagnosis, but what you can tolerate.
Neuro Pain Consultants' multidisciplinary approach to pain care has been successful in relieving suffering, improving function, and helping patients quickly return to normal activities.
I feel like I'm 18. My back feels young. I feel like running. I'm not quite ready probably. Soon I'm going to just take off. Who knows? You know, it feels that good. Neuro
Pain Consultants, committed to creating a compassionate and therapeutic healing environment. For more information, please visit neuropain.com or call 248-620-9310.